Hello, and welcome back. So in the last two videos, we talked about, one, the therapeutic alliance. We talked about how the therapeutic alliance is the working partnership between the client and the therapist. And then we talked about how when scientists study talk therapy and what makes it successful, they find that the best predictor of client outcomes is the quality of that therapeutic alliance, the amount of warmth, the amount of genuineness, the amount of empathy that exists between the client and therapist is the best predictor of whether clients go from bad to better or not. In the next video, we talked about client-centered therapy, which is the kind of therapy I engage in. We talked about how that form of therapy basically focuses on this therapeutic alliance. So other therapies might try to change how you think. They might try to diagnose you in certain ways and teach you how to be different. In this kind of therapy, we're really just focusing, in the kind that I've practiced, we're really just focusing on really developing this relationship. What does that look like? Basically, it looks like you coming into session and you directing the session. Client-centered therapy, you are the expert. And you will talk about whatever feels fresh for you. So if it's something you want to process, if it's something you want to heal from, if it's something you want to grow towards, whatever you want to do, you will bring it in, and you can have an idea before you come in, or you can just sit on the chair and just go off the top of the head, doesn't matter. And what you'll basically be doing, I'll use a metaphor here, is that you'll be going into a cave with a torch. And as you speak and as you tell more about your experience, you'll be walking along and going deeper into the cave. You'll be describing what's going on in your life, how it makes you feel, why it matters to you. And as you go along, you'll just be speaking like, this is what happened today, this is why it bothers me, this is whatever, and you'll keep walking and walking. And eventually, as you're talking, you'll get to a natural stopping point. You'll be like, and that's what that is. And at that point, I will come in and I will try to show you that I've been listening. And not just listening to what you've said, but listening deeply to what's going on and empathizing and sort of holding you in high regard the whole time. So you'll describe what happened, and you get to that natural sort of landing place, and then you'll look over to me and I'll be like, okay, this is happening, it's making you feel this way, and it means a lot to you this way. And at first this will feel whatever, right? My therapist listens to me, great. And this is like you're in the cave and you've got this, torch, and you've walked a good distance and you look back and just make sure that I'm right there. And that's me, I'll tell you, hey, I'm right there. As this goes on though, as we keep doing this, you'll get more and more confident that you're not alone in your issues, and that I'm going to be with you, and that I'm going to sort of like honor what you're saying and not judge it, and not just take you down or tell you to be different, just like going down. And as you do that, you'll have the confidence to go a lot deeper into this cave than you would normally go, because you've got someone there with you. And you'll be able to talk about things that either you've never talked about, or things you've never even realized you thought, or realized you felt, or realized you experienced. And so basically, you'll keep walking in this cave deeper and deeper, and you'll basically feel safer to go in places you've never gone, because you have just me right there with you, and you'll just keep checking in, and I'll just be like, hey, I'm right here, right next to you, right step behind you. And sometimes I might not get it, I might not get it. And at that point, you'll look back and I'm a little further back than you want to be, or I'm, looking the wrong way. And you'll have to, you'll tell me like, no, that's not right, or that's not what I'm feeling. And then we'll back up and we'll make sure we reestablish and we'll keep going. And so Rogers found that this was one of the most powerful ways to be with a person, because it allows them to explore at their own sort of rate. It allows them to go where they want to go, and it allows them to feel more and more comfortable going to more and more places. And through this, people feel like they can think more clearly. People feel like they can process things that they never would have touched otherwise. And they come to a much deeper understanding of themselves and of their situation. And this naturally leads them to be able to act differently in the world, because now that they understand the real problem, or they understand the real issue as they see it, they can now change how they're reacting. There's an old saying, it's attributed to multiple people, but a problem well defined is half solved. And so we'll just be working on just defining that problem in a very compassionate and kind way. So that'll happen over multiple sessions. You can keep going into one cave. You can jump around, like I want to talk about this one week, this the next week, mid-session, switch it up, all fine. And we'll just be working to sort of, make sure we're on the same page. And I'll just be working to be empathize with you. I'll be working to be warm, and then I'll be working to be very genuine. So I'll, just be a lot of ways myself. So that's that. So in the last video, I'll talk about, so that's client-centered therapy, and that's what you can expect. In the last video, I'll just be talking about sort of the next phase, which is once you've gotten to the place where you feel like you want to move forward, you want more skills, I'll talk about how I've created a video library of all the different things sort of I know about anxiety, depression, etc. And you will be able to, use this to, as resources if you want to move forward. So we'll talk about that in the next video. But that's client-centered therapy, and that's what you can expect in a session with